Good afternoon. We're doing part 3 of Ken in Thailand. Again, we're still with Fresh Medic, and we're at our 3rd stage of a new subject, and it's a very important subject to me and Ian. And Ian's very good at explaining it because I find we're going to talk about stem cells. We talked about PRP. We talked about fat, cleaning the fat and re-injecting it. But I think Ian, and again, you're very good at explaining that, but I think the big thing for the future, and we hear about all the time about sports guys, sports guys are getting stem cell therapy, and it's fascinating, and it sounds like to me, and then again, you can explain it to my followers, that it sounds like that this is kind of like the before an operation, a healing process that is fascinating. That, talking about PRP, this is like 10 times step ahead of PRP. It's the new thing, and it's becoming affordable for other people. So the floor is yours, Ian. Let's find out about stem cells.
Yeah, stem cells. Okay, the way I look at it in terms of anti-aging and regenerative medicine, stem cells is another tool in the toolbox, along with PRP. Now, stem cells has become quite an important tool now in the toolbox, maybe like a table saw or like it's a hammer. We always need a hammer or something like that, or an important tool nowadays. Yeah. And yeah, sports players are interested in this because their whole goal is to heal fast and get back on the field or get back and play, which is really what we've found stem cells to do. It's really rapidly helping the healing process when we have maybe traumatic injuries, things associated with nerves or things associated with muscle, tissue, ligaments, the soft tissue type injuries. There's a lot of research also on using stem cells for inflammation purposes, or even, neurodegenerative type disorders.
Wow.
So
big variety.
I do. I think it's a really big topic. And when we use this word stem cells, it's a huge, broad umbrella, okay? Because there's so many different stem cells out there.
Yes.
So once again, I think in the last part, we talked about allogenic umbrella, autologous, okay? All this means is that stem cells could be categorized in 2 ways.
Okay.
We could get stem cells from your own body, process it, extract them, then re-inject them to you.
Where are they coming from? My body. They're not the blood, right? Like a PRP.
Could come from the fat.
Okay.
Adipose-derived stem cells, ADSC.
Okay.
It could come from the bone marrow.
Okay.
Okay. So there's different sources. Yeah. Okay. Obviously, the bone marrow would be the most rich content, but it's quite painful. Most people don't go down this route unless you actually need to. Okay.
Is that like a spinal tap? I'm not familiar. Like.
I'm not really doing this here.
Yeah.
A lot of this is being used in cancer patients. I think that type of stem cell therapy.
Okay.
So this is what we call autologous. We take tissue from you, we extract the stem cells, expand them into the millions of cells, then we inject them again. There's some good research they just came out curing type 2 diabetes.
Wow.
So they took the patient's pancreatic cells, the pancreas.
Yes.
So they extracted the pancreas, the good cells from the cancerous from the defected cells. So they cultured the good cells, and then they re-injected it, and the patient's pancreas regenerated. That was just published.
Okay.
I think we'll find some good links on that one.
Wow.
So that's a good example of autologous stem cell. Now, what we're primarily using here in the clinic are allogenic mesenchymal stem cells from the human umbilical cord. Allogenic, HUCMSCS, okay? They have these codes.
Okay.
But that is the specific type of stem cells that we're using.
Okay.
So once again, allogenic means it comes from a donor. So it doesn't come from your body. It comes from
who is the donor?
There you go. Now,
who's
nowadays,
the donor?
yeah, right. And, nowadays, a lot of people have, requests on their donor.
Wow.
They want donors that have not been vaccinated by the mRNA vaccine.
COVID
Can
vaccine.
I pick my donor, and
really?
There's a lot of things that now you can order different stem cells from these different donors.
Okay. Are you saying that because COVID's been years ago? Yeah. So are you saying they're cryogenically freezing from years ago this stem cell, which is coming from the woman's
Yeah.
Yeah.
Okay. Let's go
So,
into this
yeah.
a little bit. Let's go into this a little bit.
So where do they get,
yeah.
because I don't understand,
Yeah.
where are they getting from? And
Yeah.
are they cryogenically freezing them? Because
Yeah.
you're talking about years ago now, prior to COVID, right?
Okay, exactly. Now, yeah, let's use that scenario.
Okay.
All right, you want to use mesenchymal stem cells from a donor that has not been vaccinated from the COVID mRNA vaccines. Yes, you would want to use a donor that had their tissue preserved before 2019 or before 2018, right?
Okay.
You could get a donor from 2015, let's say. You know, they're many years before the COVID even existed.
Okay.
So see, if you take that donor master lot, that master bank, and culture stem cells from that, you know, that's how we could facilitate the patient's cells.
So you keep saying donor, but where's the donor giving this stuff to you? What is it? Is
Yeah.
it? I'm a little confused on that part.
Okay.
So where's it coming from?
Yeah.
From the donor?
Well, you know, we do rely on a laboratory in Bangkok. You know, that's our partner in the stem cells. You know, we don't do the laboratory, you know, differentiation here in the clinic. This is done in a laboratory, so we rely on them a lot. But basically, the process goes. You know, when a woman qualifies to be a donor, they need to fit certain criteria. They actually need to be less than 30 years of age. They have to pass different tests associated with hereditary, you know, deficiencies, things like infectious disease or things like, you know, cancer. So, you know, assuming this female has been approved as a donor, the stem cell lab sends a team to work with her OBGYN. So she actually gets 2 teams of doctors.
Wow.
She actually gets more deeper analysis on her pregnancy.
Okay, so it's
Yeah.
coming from her pregnancy. So
Yeah.
now you're telling me a little more information from
Okay,
us
so
all.
here's how it goes.
Okay.
So now, on the day of birth, the stem cell team is in the room. And this has to be collected by cesarean section, not a natural birth.
Wow.
Just because a natural birth it introduces too many cross-contaminations. You know, some pregnancies may rip into the anal sphincter complex. Now we got a bunch of feces in the cells. All that's
Really?
unusable. You
Yes,
know?
I understand
So we got to
that.
use a cesarean section. We are carefully taking out these. You know, when we have a pregnancy, we have 2 things. We get the tissue, things like the umbilical cord, the blood that's in the umbilical cord.
Very important.
You have things like the sac, the amnion.
Okay.
Now this sac has 2 membranes. It has an outer membrane and it has an inner membrane. And that space in between the 2 membranes is a great source for stem cells that are more prone to turn into nerve cells,
Yes.
hair, nails, skin.
Wow.
So see, that little membrane of stem cells may be good in certain neuropathic pain patients.
Okay.
But so, you know, that tissue, the amnion and the umbilical cord, we're using this primarily for the stem cell richness of it. Now we also get the other that we get with the pregnancy is the liquids, the fluids, the amniotic water. You get all the placenta.
Oh, placenta.
So see,
Now I heard placenta
placenta, like the waters, the liquids.
Okay.
Okay, so you get 2 things. You get the tissues, you get the liquids. Now they found that the liquids are it's like a cocktail of hormones.
before. Okay. Are you talking about when a
Yeah.
woman is pregnant and her water breaks?
Yeah, that
is
water.
Is that what it is?
Well,
Okay.
you know, that
Yeah.
one we don't have a chance to collect
Yes,
that.
'cause
right?
it happens.
But there's other water like that.
Okay.
Okay, that is here.
Okay.
Okay. So yeah, just the liquid. You know, the idea of liquid and tissue. So when you have a live birth, you know, there's nothing wrong with the baby or mother. Okay, they live happily ever after.
Yes.
All right, this isn't the type of stem cells I'm talking about.
Okay.
Now there are pluripotent fetal stem cells. We don't do that.
Okay.
Okay, we don't do that in Thailand. All right.
Okay.
And I think if anyone offers those, I would be skeptical.
Okay, so when you're saying that,
Yeah.
PowerPoint, are you talking about a invasive procedure over and above a natural birth, getting a cesarean and taking the liquids out?
Yeah.
I'm not quite understand when you're saying that. What does that
Yeah.
mean when you say abrasive procedure? What is that? Well, how are they extracting, or what are they doing there?
Well, they're delivering a baby. That's
Okay.
all they're doing. Okay,
Oh.
so it's the same protocol delivering a baby.
Okay.
And you know, a lot of Thai women, just because of the hips and a lot of them actually are already doing C-section type birth.
Okay.
So, you know, in Thailand, you know, that's quite common already.
Yes.
But see, we're just delivering a baby.
Okay.
But instead of discarding all this, we're keeping it.
Okay, so that contaminated blood then, so you're saying a cesarean
Is not contaminated.
Yeah, it's not contaminated.
Because it doesn't go through the vagina where we
Okay.
have a bunch of things with bacteria.
Okay.
It isn't by the anal sphincter complex where
Yeah.
we have a lot of fecal matter.
Yes.
Okay.
Yeah.
Pregnancies are dirty.
Yeah, okay.
So if we have a natural birth, all that tissue may not be the greatest quality.
Yeah, you can't separate it, what you're
Yeah.
saying.
So
basically.
anyways, that's just the specifics on where they're getting it
Okay,
from this donor,
okay,
you know?
yeah.
And,
Sounds kinda gory,
but
but,
you
you
know,
know,
like their names and their social security numbers, unfortunately, patient confidentiality, you can't really know who they are.
Exactly,
All right?
exactly.
Now, when that tissue is collected, it is processed and created as a master bank. So yes, then that is cryogenically frozen.
Okay, so
see,
that's
that
what
is the
cryogenic is.
master tissue.
Okay, gotcha.
The master tissue. And that could be banked for 20 years, 50 years.
Really? Wow.
Yeah, that could be banked forever.
Yeah.
Now, what happens when we order for a patient? So we have a patient that wants these different types of stem cells. We're taking 15 million from the amnion. We're taking 10 million from the umbilical cord.
Wow.
We need 25 million total. When we, you know, the donor shouldn't be vaccinated by mRNA. We want to, you know, if we place this order, the lab draws from the master bank.
Okay.
And then they do what's called passages. So they take this small population of stem cells and they start expanding them, okay, growing them to the 25 million cells that we ordered. So off of a small population of those stem cells, they pass it through these different passages. Now here's where these labs, you know, I've learned this throughout the years because I'm the one, you know, who actually works with the orders and I know the capabilities of these labs.
Wow.
Now when they're expanding from the master lot, some people may use animal protein growth factors to expand it. So we got to give it a little food.
Okay, so you're feeding. Okay,
We got to
I
give it a little
understand.
food, you
Yeah,
know?
yeah.
And then we put it in the incubator, or you grow them. You know, what food are we giving the stem cells?
Okay.
Some labs use animal-based protein factors. The lab we've partnered with and the ones that we actually ended up trusting all these years, you know, about 12 years ago we worked with them, they only use human-based growth factors. Okay, this is a big difference.
Okay.
Okay, the food that we're giving the small population to expand them into the millions, what kind of food are we giving it?
Okay.
Same as what, you know, nowadays we talk about the chicken egg.
Yes.
What kind of food are you feeding the chicken and then I'm eating its egg, right?
Exactly.
This matters.
Okay.
The diet of the chicken matters.
Yeah, exactly.
Right? So that we believe that the diet of those small population stem cells from the master bank, whatever growth factors we give
Yeah.
it, this matters.
So I'm just going to cut you short there because one question I want to ask you, talking about the chicken egg, okay, you're talking about enhancing the growth of that particular cell, okay, to get the best for the injection for stem cell. Now, talk about the chicken egg. And the chicken egg is, if you feed a chicken steroids, okay, food steroids, the chicken grows quicker. So you always hear these myth stories that, you know, women with big boobs, they were eating lots of chickens. And
there you go.
because it enhanced. Again, it's probably a myth, right?
Yeah.
But I always had to laugh because, all those, you know, from that country, they're all eating lots of
Right.
steroid chickens.
Right? It's true. I hear
Is it?
about this.
Are you
I think
really?
I think it affects. Some people believe it.
Okay.
Now they have free range chickens.
Okay.
They care about that. They're eating the natural bugs running around. They're not
Okay.
eating the stock feed all the time.
Okay.
I don't know. You know,
So it's
stem
not
cells
just me
same.
who heard that.
Stem cells the same.
Okay. That's what I'm saying.
So
yeah.
see, what food are we going to give this to expand them? I think, you know, it matters.
Yeah, yeah.
And where we found it matters is the allergic reaction some patients get.
Okay.
Okay. Dr. Ann actually, she had an allergic reaction. You know, this
Okay.
happens like 1 out of, I don't know, 100,000 people.
Okay.
Very rare to find this.
What happens? A rash or what?
Yeah.
Okay.
And why it's important is because, you know, it's not really the stem cells. We're not allergic to the MSC. We're allergic to the culturing methods that were used to get those cells.
Gotcha.
So really, it kind of rules out any type of, you know, a person has an allergic reaction. So the first thing we're thinking is, oh, where could that have been? Is it because of this, because of that? Did we not screen them correctly? Was this like that? But, you know, sometimes it may boil down to, you know, what was the culturing method?
Okay.
And that's where maybe some of these pitfalls can be alleviated, or we rule them out. That's
Okay.
what we call, we rule them out by making sure we're using human-based protein factors and everything just, you know, clean and natural to
Yeah.
our body. We're not introducing a foreign substance or a trace substance of another species.
Okay, gotcha.
So yeah, I think that's what's important. I think
Okay.
when we talk about stem cells, and when we administer them. So I think a big thing when you were talking about affordability or availability, really it's all about time. Because unlike, you know, vitamins, right? Vitamins, you can just like sit on the shelf. It's, you know, you can eat them within 3 months or, you know, they got a 2-year expiration. Stem cells have hours of
Okay.
expiration because they're dying.
Okay.
They're alive.
Okay.
And so when that lab finishes them, they
Yes.
send them here within, You know, we're usually injecting them within 3 to 6 hours
Okay.
after they've been made.
Okay, so
But
they're cultured
every
and
hour you
delivered.
wait, the cells are dying off.
Okay, got you.
Okay,
I got
so
you.
this
That makes
is
sense.
so that's the workup
Yeah.
patients get. You get a patient copy that shows you the viability. Viability means the percentage of alive.
Okay.
How many cells are alive?
Okay.
And then if the patient isn't here, we didn't make a good appointment, the guy has to reschedule. Oh, now we put it in a refrigerator and they're losing 7% every
Okay.
12 hours or something.
Wow.
So they're starting to die off.
Okay.
And I think that affects the cost.
Yeah,
This
definitely.
affects. Has to be very timely managed by everybody in play here.
Yeah.
When we got to make sure we get the best quality cells.
So again, one thing I'm going to ask you, and that's very interesting with the stem cells, and you pre-order them and you have a timeline to use them. Thinking back, organ donating. Okay. Let's face it. When you donate an organ, there's some of them where you can use your spouse, different blood and whatever, and you can actually go with your family and you can donate something. But when you lose a lung or lose a heart or whatever, there's a timeline on everything. So I wonder when they're going to, and again, advancement in technology and in medical it's just mind-boggling. How many things are changing, right? For instance, you look at Elon Musk, and he's putting neurotransmitters in brains now, and people are doing things that they never did their whole lives. Like, I mean, technology's changing so much. And I wonder how close we are to regenerating a bad heart, through stem cells. Like, you think that's possible in the future?
I think so.
Anything's possible.
I think we're getting there.
Oh, really?
I really do. I think we're getting there. I think the evolution of stem cell therapy throughout the years has been changing all the time. Like I said, if you're not up to date, if you're not doing continuous education, it's fields like stem cells that's going to run away with you.
Yes.
Like if you stay out of the game for like 2 years, you may not even understand what everything I'm just talking about right now.
Wow.
Because as it's evolving, you got different companies offering different growth factors for cells now. The industry, the verticals are all expanding. So there's different capabilities and yeah, I look at things like Elon Musk is doing with Neuralink. He's working within our, neural pathways, stimulating them electronically.
Yes. Amazing stuff.
That's one thing we try to do here is to target stem cells, direct them. The thing is we want to direct them, and one of the things that we direct the stem cells with is with PRP.
Okay.
So see that those tie in together.
Okay.
Also, we use things like peptides.
Okay.
BPC 157 or TB 500.
A direct injection of peptide is, some people call them steroids.
No,
they're not a steroid. But some people have a misconception on what a peptide is.
Peptide, it's like an amino acid. So this is a broad term. This is like a term that's like, oh, it's a peptide. Well, okay, there's a lot of peptides here.
It's like saying Ozempic, but there's many different types.
I don't know. Maybe this is a whole nother topic.
Okay, I got you.
But in stem cell terms, if we focus maybe on stem cells and PRP, the idea is the PRP, when there's all these platelets and it's creating this reaction in your body, because we all have stem cells, okay?
Yes.
We all have stem cells. We have them in a reserve. Now, they haven't been
Regenerated. Our bodies
Now, they're
regenerate.
in a reserve, right? But they haven't differentiated into a muscle cell, a cartilage cell, a bone cell. They're the stem cell form.
Yeah.
But when you put all that PRP in there, your resident stem cells come to the area, then they differentiate,
Oh, I get
and then they heal the area.
Okay.
But when you get higher up in age, that reserve of resident stem cells, may not be at the most level.
Yes.
You got a traumatic injury like you're saying, but
Yes.
I guess you did that in your 30s. But imagine doing that in your 60s, okay?
Yes.
Now, you may not have a good reserve to heal that, so this may take a long time to heal.
Okay.
May not heal completely.
Yes.
So that's why stem cell therapy is, it's non-surgical, so we inject all those millions of cells as helpers.
Yeah.
Extra resources for your body to take. And, we hope, hopefully we have good environments, good nutrition before we inject the stem cells. The bloodstream, everything is good environment so that they can thrive and expand and grow.
So basically, if you're have a disease and it's got to the point where it's drained you of your energy and you have a lot of problems, okay? So that might necessarily mean that stem cell can't rejuvenate as easy because your body is depleted too much. Am I understanding that right? Because let's face it. I mean, there's many diseases that you don't die, let's just say for AIDS, you don't die of AIDS, you die of ammonia. Okay, AIDS is something where it starts and it starts eating something away. Am I right?
It's an autoimmune disease, so the immune system is broken.
Okay.
So the doors are open for pneumonia to come in. There's no system of defenders here.
Okay.
So that entire system of immunization has been compromised.
Okay.
So then, yeah, that's why HIV is just compromising the entire system.
So I know we're not talking about HIV, but I mean, you do test for many things here. So is HIV, are they HIV blockers now? You know, like, is there something that when you get AIDS, you can, like, okay, for Magic Johnson, okay, one of the first guys, superstars that got AIDS, but yet he's still alive, you know, and, you know, Queen, the singer of Queen, he died of AIDS because that was, you know, in the 70s. Yeah. Okay, so is that blockers now? Like, what stops AIDS from growing? You know?
Well, this isn't really my wheelhouse.
Understandable.
But there are medicines, drugs on the market that you can take before being exposed to someone with AIDS and after you've been exposed to someone with AIDS. So there's these.
That's why people are living.
No.
No?
That's why people are not getting it in the first place.
Oh, because you're taking it before drug?
Or after.
Okay.
Okay, now, once you've already been infected, yeah, there's another class of medications that are treating it. I don't really know about that.
Okay, I got you. Again,
now,
we don't want to get into that.
When you talk about immune system compromised, yeah, we don't want that.
Yeah.
That's why the stem cells have to be from a donor that doesn't have HIV, syphilis, infectious disease. So see, stem cells have to be cultured. They got to be tested. So see, patients usually get the test result from the master lot and the cells that they're getting, the one that's been cultured. So they actually get 2 sets of reports. All of it always has to be tested for things like HIV, herpes simplex virus, syphilis. You know, these are things that we can't introduce to
Exactly. So the extensive part of getting a stem cell is very, very advanced. Like they are going over and above. So when people have to realize that, you know, the checks and balances are all done there.
But last step, we also need it third-party verified. And that's where all the other labs drop the ball, and that's why I don't work with them.
Okay.
Because they go, yeah, all this is good, got the growth factors right, you're gonna time this out, we're gonna deliver it, we're working together, your donors are categorized, we can pick it, but you don't have third-party verification.
So are you saying that then the success to your business is you do that third step? So
I don't, the lab does, and I choose to work with the partner. My partner is thorough. They're ISO certified.
Okay.
They are ISO certified. Some stem cell labs in Thailand are not.
It's very good to know.
Does that blow your mind?
Yeah.
Some stem cell laboratories in Thailand are not ISO certified.
Okay.
And they don't verify through third
So
parties.
I hope everyone's listening
So
to
you
this.
take
This
their
is
word
important.
for it.
Yeah, this is important.
The guy prints out the test result. He goes, that's it.
Assumption.
But I like that. I like it.
Yeah.
But I also want you to verify by third party, and that's not my responsibility. It's yours. And
that's awesome news.
yeah, that's what they.
That's so good for people to know because, you know,
there's nuances like this.
You know, and when it comes to medically, and it's so important that you feel comfortable with the procedures you're doing. You're thinking you're getting a great procedure, and you know it's going to prolong your life, and then something like that comes along. And then it gives you doubt, and it gives most people a doubt. Well, do I want to do that? I heard a bad thing about this, bad thing about that. So the fact you're getting that third-party clarification, that is really good news.
Has to be.
Yeah, it's really good because again, as you said, there's some places that don't do that.
Yeah.
So I'm glad to hear that. I never knew that. I'm glad for you guys. So that's good to know. It's good for people to know that.
Yeah, some people don't understand those nuances. And see, these are things that affect pricing.
Yeah.
So see, I think when everyone talks about prices or what stem cells, first of all, what specific stem cells are we even using? Okay. Are we talking about the same stem cell?
Yeah.
You know, sometimes we get misquoted on fat stem cells they're going to take from their fat, re-inject.
Yeah.
But I'm talking about umbilical cord from a donor. We're talking totally different. And, you know, pricing, misunderstanding. So see, there's a lot of things that go into this.
So for all new patients and for my followers, it's not, okay, I'm going to go here, here, and here and get the best price. You really have to get the bang for your dollar and make sure if somebody is giving you, like, you know the old saying, if it's too good to be true, it's probably not real, okay? And in many cases of buying many products, like doing medical procedures, you know, if one doctor said to me, like for instance, I got my shoulder operated on, it cost me about 240,000 baht. If some doctor said to me, I'll do it for 150,000 baht, you gotta go. Am I getting it done in the back alley? Okay.
Yeah.
Hop into the back of this truck.
Yeah.
So I think it's kind
Yeah.
of important when people are thinking of their lives and their future and their health, that they know that Fresh Medic goes over and above that step to make sure you're getting the right
Yeah,
product.
I also think, just before, just in my experience, whenever some doctors or some clinics, they prefer to separate all these treatments, okay? So a patient may think, I bought stem cells, but then I have a charge for PRP, then I have a charge for blood testing. What's going on here? Why do I need this? Why do I need that? And then all these expenses are adding up. See, I think for us, we just give one price package. And so everybody, so I think, the package price or the prices that people feel like to do stem cells, it costs X, and then, right? But that includes maybe up to 10 different treatments.
Yes.
Some of this is 20 treatments going on in here, and we just kind of, it's how do we bundle this? How do we communicate this to a patient? Because it may be hard to understand for some people.
Yes, I understand that
And
too.
see, I just think that the devil's in the details.
Yes.
A lot of times when we talk about like NAD, those vitamin drips, for example, we prescribe that off of milligrams.
Yes.
So we'll say, hey, you may need 2,000 milligrams per year of NAD.
Yeah,
Other clinics may say you need 4 times.
Ian, I want to talk about your vitamins and also the vitamin drip. I'm very interested in that, and we're going to leave that to the fifth part at the end because I think now you gave me a really good explanation to my followers of stem cells. I really appreciate that. I think you gave me an eye opener, and I'm sure a lot of other people on. It's not always about the price. It's all about it's in the procedure and also knowing what you're getting for your dollar.
I mean the specifics.
Yeah,
I
exactly.
guess.
Very important. And again, when people come to Thailand and they think that, I come to Thailand because I get it a third or the 10th the price. Remember, are you being pre-charged for everything else? And as you said, you sell the proper package, and then you explain that to people so that if they do get something undercut you by 50%, you better watch what you're reading because they haven't added everything else onto it.
Yeah.
Okay, Ian, thanks again.
Sure.
I'm interested in talking, I'm really interested to talk about methylation because I got my methylation test done with you guys, and I know you got the test done too, and Dr. Ann got it.
Yeah.
And when I first read the methylation test, and we're going to talk that down next, I was quite shocked, and I'm excited to talk about it. So we're going to leave it for now, and we're going to get into methylation next. And it really, it's a really important part of our talks today. So please follow us because I think you're going to find methylation very interesting to listen and find out about with Fresh Medic. So thank you very much, and we'll talk to you soon.